In our morning rounds, the rise of telemedicine. The number of people using their phones and computers to connect with a doctor is skyrocketing. 800,000 online patient consultations are expected this year alone, and that number, they say, could double in 2016. Dr. Holly Phillips is here with a digital diagnosis. Dr. Holly, good morning.
Good morning. When you're sick, getting out of bed can seem like a challenge, and going to the doctor a near impossibility. That's if you can get an appointment. But now there are apps for that. We tagged along to see how it works when doctors come to you, bringing convenience along with some questions.
Hi, this is Julie, the nurse from Pager. I saw that you requested a health check.
I did.
39-year-old Oliver Gold hates to go to the doctor. So when he wanted a checkup, he tried out the new Pager app on his smartphone to have the doctor come to him.
Okay, so what time works well for you?
After an initial consult,
Hi.
Hi, Oliver.
a short time later, a nurse practitioner shows up at his door. She checks his cholesterol,
195.
calculates his BMI, and takes his blood pressure.
Good. Your blood pressure is 118/70.
How did you feel having the nurse come to your home?
It was really easy and convenient. I don't know that I'd have done it otherwise.
Using the Pager app on your smartphone or their website on your computer, you can get medical care from a board-certified doctor or nurse practitioner at home within 2 hours. Their newest service is the wellness visit Oliver had, called Health Check. But they're most often called for urgent matters, everything from stitches to strep throat tests, and can write prescriptions.
It's all about you sitting back while you're sick or keeping your kid at home resting while the healthcare comes to you.
Toby Harvey is the general manager at Pager, one of several new startups that bring doctors to patients with digital technology.
What Pager is going to be is your healthcare in your pocket.
If it sounds a bit like Uber for doctors, that's no coincidence. One of the company's founders was also on Uber's founding team. After just 1 year in business in New York City, Pager has plans to broaden out nationwide. House call apps are just one part of what's being called the telemedicine explosion. Other apps like Doctor on Demand, Teladoc, and Amwell connect you to a physician through your phone.
Hi there.
Hi, how are you?
26-year-old Rob Hayden video chatted with a doctor using the Amwell app after having sudden eye swelling, a possible allergic reaction to shellfish.
That really sounds like an allergic reaction. I'm glad that you didn't have any other symptoms.
The service provides live video consultations with board-certified doctors 24 hours a day, who can offer advice, prescribe medicine, and suggest follow-up care.
I think allergist is definitely the way to go.
They can kind of give you an immediate response no matter what. Knowing immediately is just a huge peace of mind.
Rob sees the service as an alternative to an urgent care center or waiting hours in the ER. And like many young people, Rob doesn't have a primary care doctor.
I've lived in 3 cities in the last 5 years, and so a lot of times finding and establishing a relationship with a doctor then just to move again ends up being difficult.
The surge in telemedicine has raised questions about the safety, quality, privacy, and limitations of this type of care. Several states are weighing tighter restrictions of the visits, in some cases by requiring doctors to see patients in person before providing treatment by phone or video. By bringing back the old-fashioned house call, Pager's doctor visits bypass many of these issues. So do you think that this is a passing fad, or is this the new future of medicine?
In a lot of ways, it's back to the future, and this is where medicine is heading.
Pager's house calls range from $1 to $200, and video consultations using the Amwell app cost $49 for 10 minutes. And some insurance plans may reimburse you for a portion of the cost.
Sounds like both are really good ideas. How do they compare to, an office visit, seeing the doctor in their office?
Right. Well, neither of these services take the place of having a primary care doctor, and that's because of something, that we call continuity of care. Seeing the same doctor over and over, ideally for years, translates into better care, from diagnosis to prevention to treatment, and these apps can't offer that yet.
It's nice to have a doctor that knows you, knows your quirks, knows your body, and then
knows your medicine.
And knows your medicine.
And
This is a good idea.
And you say Pager is really exploding.
Yeah, the idea of having a doctor come to you, they can still do the laying on of hands. You end up with better care that way as well.
Great. Dr. Holly Phillips, good to see you. Thank you so much.